What's up, you guys? This is Will Miguel giving your daily dose of radiation. Today's video, we're covering helpful tips to do cross-table hips. So, to give you context, I'm a night shift Xray tech. I've been doing it for 4 years. Also dabbled in a lot of day shift because of overtime. So, cross-table hips, the infamous Adelnis Miller method, as it is known in the Bontrager Bible book. So, depending on your patient and how, wide their hips are, how big their hips are, or depending how well they're able to move the opposite leg, there is many variables that will affect your image quality. I would say you can have everything positioned correctly, lined up correctly, but if your technique is not good enough, and most of the time, most newer techs or even students under-penetrate technique, so most of the times you'll have to shoot it pretty hot, just simply because it is going through the femur / hip across, and there's like a big chunk of SID to go with it. Most of the times, I would say that if you cross-table the lower, like let's say you're doing the femur, if you cross the lower is not a problem. It's more like the head of the hip of the femur, or just like the upper hip cross-table is the problem that you'll encounter. So depending on if the patient has a prosthesis or if they're just like really big, you will have to shoot it pretty high. I would say like an average patient, 180 to 200 pounds. Like on my Fuji portable, we shoot it probably at like 85 kVp at 45 mass, which that is pretty high. To give you context, we shoot our chest x-rays at 80 at like 2.5 kVp. I mean mass, sorry. So yeah, like 85 kVp and then like 40 to 45 mass. That's kind of where we're at with those. And then you have to kind of tightly collimate it, and then you shoot that at that technique, and then kind of based off of what we see. If it's prosthesis, sometimes it will get burnt out. Other times it won't get burnt out because you shoot it with the grid. Always shoot it with the grid. It's better, especially for prosthesis. And they never come out perfect unless like the patient's super skinny. They come out pretty good, but like most of the time they don't look good. They look pretty burnt out. They look like, because the main thing you're looking at is just like the head of the femur and like the portion of the lower of the hip. That's mainly where you're looking at. So there's like a lot of variables that will go through. You always have to set your own technique with that. And I mean, with the bigger patients, I've even had to shoot all the way up to 90 kVp and like 50 on the mass, and it's still, yeah, those x-rays, like you gotta make sure whoever's holding it and whoever's sending the technique, make sure everything's good, because that one, you'll feel that one. That's a long beep. Like when you press that hose, like beep. Like it's a good long. It's a lot of radiation, a lot of scatter. Like I might recommend more than 6 feet if you're not holding the lead. And for those, there's a lot of scatter. Yeah, spring room we go. See you on the next one.